much it's our privilege that the person in whose name the oration is, Dr. M.K. Sinad is here with us. So may I request sir to please come onto the dais. It's a privilege on our part to have himself present during the oration. This GDBP chapter oration is in the name of two stalwarts, one in the field of development, Dr. M.K. Sinayar, and one in the field of growth, Dr. Dilip Mukherjee. Both of them have been past presidents of Indian Academy of Pediatrics, Dr. Dilip Mukherjee in 2002 and Dr. M.K. Sinayar in 2004. Needless to say, they were the pioneers in developing this chapter, nurturing this chapter, and motivating thousands of pediatricians into taking up development and growth as their special interest. Many stalwarts have delivered this oration, and this year we have the privilege of having Dr. Srinivasan. May I request the Secretary of GDBP chapter, Dr. Sunil Godbole, to please come and introduce Dr. Srinivasan.
Thank you all for being here for this very, very important oration at this time. And I really see through this event as a very, very unique event when the person whose name is there as a oration, Dr. M.K. Sinayar and Dilip Mukherjee, and the person, Dr. Srinivasan, are both together. I'll start with a very different resume about Dr. Srinivasan. When he passed his MBBS, I was born. So those 45 years is working as a person in this medical field in the pediatrics. He is a very senior pediatrician. He is a professor in GIPMA and head of the department there in Pondicherry for many years. He has got some other very important activities in his shoulder also, that he is a founder of BPNI since 1991. He is a national trainer of IYCF since again 15 years over the time. And he has been conferred with WHO fellowships and of different varieties at now. And on the top of it, with so many years of experience, so many activities, so many rewards, so many awards, he's still working as a very zealous pediatrician. You and me as a young generation, we think that we skip this activity and all, but when it comes to Dr. Srinivasan, he doesn't miss an opportunity to learn again at this senior age. I think with this short introduction, we'll again thank Dr. Srinivasan to accept this oration of Dr. M.K. Sinayar and Dr. Deep Mukherjee oration, and we confer this oration to Dr. Srinivasan, and we request him to deliver his keynote address for oration. Thank you, sir.
Thank you, sir.
I thank the organizers for giving me this great opportunity to give this oration on two great doyens of developmental pediatrics, Dr. M.K. Sinayar, whom I know for so many years, and I have been associated with him in many ways. I have even gone to his house. He has started the developmental clinic, and how he was talking to adolescents and trying to solve their problems, etc. And subsequently, of course, he has called me for PhD as examiners. Am I audible? Clear? Okay. So that is how I have been associated, and I am indebted to his love and affection for so many years. And of course, Dr. Deep Mukherjee has been very kind to call me every time, like our NR Srinivasan conducts, and Gunnar Singh used to conduct the PG program, before the examination, mock examination for them. So he used to call me to Vivekananda Institute where he was conducting such things. So I have attended 5 times. So I have been very blessed to be associated with such great people who have done so much of work in bringing awareness about growth and development and behavioral pattern of children. So I'll just go ahead with that. So of course, I'll go through the slides a little faster because already Dr. M.K. Srinivasan, everybody knows. Okay, yes. So of course, many of you may be new as students. So these are the goals and aims of academy which is there to improve the health and well-being of all children with dedicated efforts. That's very important. Dedication is very important if you want to make changes. And using all available resources at our resources, both, of course, resources doesn't mean that we have to have so many big things and all. You can go to the village and find out resources. You know, those culturally acceptable toys are available, okay, to stimulate children. To strive for the achievement of the optimum growth, development and health in the physical, emotional, mental, social and spiritual realms of all children irrespective of diversities of their backgrounds. So everybody is endowed with same amount of brain and then brain cells, etc. Only thing what is important is how they are being groomed. See, most of the times parents criticize, point out the faults, but they hardly praise the positive things. So positive enforcement is very important to develop the ego and superego of the children. To sensitize pediatricians, other professionals from local IAP and other organizations like IMA, etc. Already it has been mentioned in detail, so I'll go to the next slide. So of course, teaching experience of pediatrics, 40 years of distinguished career, and he has gone abroad so many times. And Dr. Nair mentioned how he was, with 14 people, he had started the whole growth and development behavioral chapter and provided food from his own home. Okay, so that is the type of person he is. So affectionate and parental in attitude. So he has done a lot of pioneering researches, Indo-US ICMA project, Indo-UK project, just like M.K. Senior has done. 120 articles, national, international journals, and chapter of several nationally, internationally published books. And first book is M.K. Senior and Dr. Dilip Mukherjee, they have published on that. So these are the things, and these are the employ and demonstrate appropriate knowledge. Okay. Correct techniques of measurement. That's very important. Just now Kadilkar was mentioning about how to measure and how to plot. Okay. So it's very important. Select, plot and interpret correctly. Interpretation is very important. And the same findings in the appropriate growth and development research properly, weightage, height age, bone age and versus chronological age. The importance has been just now mentioned. To interpret correctly the underlying basis of any deviation of growth and development and how to explain to the parents, and then if it is nutritional, try to help in improving their nutritional status or try to investigate and find out what is the possible cause. To apply appropriate scientifically sound statistically relevant methods which Dr. Kadilkar has mentioned, Vaman Kadilkar has mentioned in detail, and also Dr. M.K. Sinha just now mentioned. To analyze and diagnose the etiologies of deviant growth and development, so to find out the cause, already it has been discussed in detail, short stature. Emotional deprivation is very important. So nowadays, emotional deprivation is a very important cause, and I will talk about adolescent suicides. Recently, you must have heard one film director's, story writer's daughter has committed suicide. So he has done films about suicide, etc. Adolescent suicides are becoming more common, especially Pondicherry is now standing first. About, I saw the latest statistics, 37 or 39 per 100,000 suicides are occurring. Next is Chennai state. Okay, previously Kerala was leading, now of course it is less. So it's very important that adolescents should be given appropriate love and affection, and also they must have the confidence the parents will not this thing. So they must be ready to come and tell whatever is happening in their life to parents. I'll give some examples which I have seen. And to plan and institute appropriate investigative treatment management, which of course have been referred in various talks just now. So of course he has got B.C. Roy Award, and he was also the president, and of course American Academy of Pediatrics at Boston, Distinguished International Guest Award was given. Such is the eminence of this person who started along with M.K. Sinoyer. So now M.K. Sinoyer's books are already known to everybody, and he is both Noyer and this thing, Dr. Naveen Jain, they have recently edited. That is a great honor because I, as a MD student in Maulana Azad 74, 76 with under Satyagupta. So there were three DCA students who used to take me and present cases to me, etc., and get benefits. So I presented the 5 volumes of Illingworth, normal child, preschool child, and this thing. So that is for their birthday. I gave it as a gift. So that is the importance of that book. Of course, it will take 1 day, 2 days to tell about MK Sinha's achievements. I will skip the, okay, so all of these are available in this thing. See the number of books. Why I am showing this slide? Because so many youngsters are there who are having talents of writing, etc., and documenting. Whatever experience you are seeing in your day-to-day practice, kindly immediately document it and keep it this thing so that you can publish it later on. So that is very important. You can also write great books with your experiences. So that is the reason why I am showing this slide. Next. So this is Dr. Balakrishnan, Purusu Balakrishnan. He is brother of Chandrasekhar, Nobel laureate Chandrasekhar, and also nephew of C.V. Raman. Both of them are Nobel laureates. And he did DNB in pediatrics in Canada, and luckily he came to India back. And then he was in Delhi, and then he came to Pondicherry as professor. And he used to take rounds. So it will start from 9 o'clock till 1:30, 2:30 he will take. Each and every mother he will ask history properly, and he found out the typhoid pneumonia. He found these children are having pneumonia more than in north where there is so much of winter, etc. But why these children, especially below 2 years, are coming with repeated attacks of respiratory infection? And he made us this thing, take the history, and then he found that there is oil instillation. That is, during oil bath, the midwives are asked to come and give this thing, take out the phlegm, and they put oil in the mouth and blow through the nose, and then I had done lung biopsy. Those days, ethical clearance was not necessary, but none of them had complication of pneumothorax or this thing subsequent to that, because it was consolidated. And then it was published in 1973, British Medical Journal, typhoid pneumonia. Yes, Balakrishnan, you see, and it's still happening. Day before yesterday, I was talking to somebody, and he is a computer engineer. He says in his village, still people are doing it. Subsequently, of course, it has been found in many other places of India, such practice is going on. And he is the person who instilled the importance of reading child psychology. See, the Nelson had this thing, he talked about all the PRA's hypothesis, then Sigmund Freud's psychosexual theory, psychoanalytical theory, and Erik Erikson's. And then he will drive it. He will talk about the importance of ego and superego. All are important for the development of psychological behavior of a child. So that is the type of teacher I had. So I am thankful for instilling the importance of growth and development in my mind at that time. Dr. Indra Narayanan, she is the daughter of Doraisamy, who was an orthopedician, and he was Director General of Health Services at one time, and she studied in Lady Hardinge, and then she married the Professor of Thoracic Surgery in Pondicherry, Dr. Narayanan, and she is a neonatologist. She worked in Lady Hardinge after her husband died of heart attack, and she will be very meticulous. She started the NICU in Jitmar, and every child, preterm child or other child, high-risk children admitted, we have to take weight and length measurement, and also look for congenital malformations, etc. She was very meticulous. And then those days, of course, the breastfeeding was not that this thing. So these children, mothers were kept in the post-operative this thing for more than 48 hours. The child be kept for observation in the NICU. So she will ask us to see weight and this thing, and that is the meticulousness with which she will ask us to take blood pressure in children, and she herself will again check the blood pressure. So that is the type of meticulousness she was following. So that is, she is of course now a consultant in global maternal, and she travels a lot teaching about neonatal resuscitation and neonatal stimulation, behavioral stimulation, and she is very popular there. Of course, during our posting, MBBS, we didn't have a psychology department at that time, so we were posted in Bangalore for 1 month. So we were posted in NIMHANS. So we were exposed to how a child with behavioral problems are looked after and also neurological problems are looked after. That is another important thing which helped me to understand the problems of children with regard to neurological and behavioral problems and developmental problems. So this is Dr. Kanpur. He is a AIMS teacher, and he was also contemporary of present this thing, but he came to Pondicherry as a senior specialist. So those days, so many children are admitted in Pondicherry General Hospital in the veranda. Those days, diarrhea, dehydration, nephrotic syndrome, nephritis is very common, tetanus were common. But he will want us to know the by heart. See, we will be looking after 15 children. He will want us to tell by heart. You must remember the growth parameters of the child. You must not refer the case sheet. So that is the type of this thing. And then one day our child was admitted with a severe jaundice, which can cause kernicterus and developmental disorders. So what he said, Srinivasan, have you to wait for the laboratory report to come? It may take 8 hours those days. You know that this is definitely more than 20. Why don't you start the oxygen transfusion? That is the type of teachers we had to stimulate us. And he was the first one to start peritoneal dialysis in GH Pondicherry. So I owe much to him, and he is no more. He died while climbing. He was in Kalavadi Saran as a consultant and professor. So this is, of course, she has motivated so many people for taking preventive pediatrics and developmental pediatrics to community. And of course, Arul Murray is a relative who died very young, and she has started developmental center. And she is the professor of Dr. Kamla. So I also appreciate her contributions to go to the community to do both growth and developmental assessment and stimulation. You can see how happy she is and how the children are educated. See, high-risk infant clinic was started in 1988 in RSRM. Okay, so one assistant professor, 2 PGs are posted, etc. Recently, she became 90 years. They celebrated her birthday. That is how I got these photographs from. See how the growth chart and how the developmental chart is being explained. Can all of you see that? This is Dr. Satyagupta. She was came from England and came as a reader in JIPMER as the first pediatric professor and started the postgraduate course. Then she went to Maulana Azhar. I was fortunate to go to do MD in 1974-76, and she was also very strict about growth and development of a child. So, and of course, she is a tough taskmaster, and nobody can escape. Okay, so these are all people who shaped my future. Okay, if you call me teacher of teachers, it is their contribution that I am here talking today. And P.S.N. Menon, when I was there doing PG, I was staying in All India Institute before I was given a hostel accommodation. So that time I came to know about P.S.N. Menon, and he is a pediatric endocrinologist, all of you know, and he has published so many books, and he is pivotal in bringing the concept of endocrinology, growth and development, etc. And he is a very good friend of mine. Okay. So he has written pediatric endocrine books, so very well read by people. So kindly remember that read books as much as possible, because these people have done so much of work and they are giving their. So I will not go to this thing, various this thing, because of lack of time. And of course, P.S.N. Menon and Meena Desai. Meena Desai is one of the pioneering pediatric endocrinologists in Mumbai, and she and Kolako conducted the Indo-British Commonwealth Endocrinology meet, which I had happened to attend. Okay, and of course that is how they nurtured, and so many pediatric endocrinologists in India have come up. And attended, of course, I have just now mentioned. Then Raghupati, he is very close to me, and we have been regular examiners, and he was in Vellore Medical College, and then he went to this thing, after retirement he went to Bangalore, and he is very particular about development, growth and endocrinological aspects, and he is a complete pediatrician. They are all very particular about these growth parameters to be mentioned and properly entered in the case sheet is very important. Okay, Raghupati, of course, he is doing so much of good work even now, very active. Anurag Pajpai, all of you know how much he has contributed, and he has also written so many books on that. And just now you heard about the growth charts. Okay, Kemchand Prasad is in Mehta Hospital, where I am adjunct professor there. So he is also doing wonderful work. And of course, she is a very close friend of mine. Okay, Dr. Madhuri Kulkarni, she has been doing wonderful work in Sion Hospital about the developmental disorders of children. Then, of course, we used to, I told you, we used to go to Bangalore for psychiatry posting, and everybody would have heard about Mahadevaya, who has done pioneering work in giving help to these children, unfortunate children. Okay, educating, counseling parents to make a choice on therapy, family-centered approach he introduced. Nandini Mundukar was 1 year junior to me in Maulana Azhar, and she had taken interest, and she is in Bangalore doing a wonderful work on developmental pediatrics. And of course, you know Jayantini. Jayantini and Papa Kumari are two important child psychologists who have done excellent work in Chennai, and they have gone also to various districts and conducted autism awareness, attention deficit awareness, etc. Of course, is very important growth chart. So this is the growth chart which has been made, wrote Priorities in Developing Countries, a wonderful book worth possessing. See how he has, and he has given talk slides, education slides to free of cost at a concessional rate to developing countries. They were available as slides those days in various medical colleges. And these are the aims he has mentioned. I will just read it. A driving force for children's health worldwide for 50 years, actively advocating the key themes of the career, growth and nutrition, involvement of parents and children in own health care. That is very important. That's what I am going to tell. Involvement of the parents to find out what is happening to their child, because they know better than any other person. Then, development of educated and trained community health workers. There is another point which I am going to stress in my take-home message. Bottom up rather than top down approach. So naturally everything we must not get forced by somebody from above. So it must be coming from bottom approach. That will be successful always. Offering rather than withholding knowledge. Okay, so never withhold knowledge. Whenever you know something is true and then realistic and achievable, then can convey it to your students. Parental empowerment to be the key health message is very important. So parents must be this thing, and they should be told everything about the child, and then they should be made to do the help to the child by giving adequate training. Then road to health code and talk is an important thing which he has mentioned. Of course, now it is MCP code. Government of India is giving us MCP code, Mother Child Protection Code, to all the hospitals and village workers. Then Umesh Kapil, okay, Department of Gastroenterology Human Nutrition Unit, okay, so Integrated Child Development Service Scheme in India, and he has monitored also the work of Anganwadi workers, ICDS program, how it is going on. So UNICEF GoBe program, all of you know. So this is often asked question in Viva, what are the 3 F's, etc. So you know about it. So this is the most important beginning of this thing, that is history. So when Chaudhary asked me, why me? My eyebrows were this thing. He said, are you in town? Will you be available? I said, are you sure you are asking this Srinivasan or the other Srinivasan in ICH? Okay. Then, of course, I even sent a message to Dr. M.K. Sinha, I remember. So he said, no, it is you only. So I got it clarified from, of course, as I mentioned there. So at JIPMER, why undergraduate, postgraduate, my first clinical posting in pediatrics, or at my first encounter with any PG or UG student attending pediatrics meetup workshop, I asked them define pediatrics. Even now I ask. Yesterday also I asked in library, I went to see library, there are only e-books. There were no books except for SC and ST, they are having books in print. That's why I told you, don't give memento, only give books so that they can read. Because, people are writing books and we are all getting, So no mementos hereafterwards, because it's lying in the cupboard and you don't know where to throw it once. So I give them a start. I always tell them pediatrics is a branch of medicine dealing with children. From when to when I ask, they will always say from birth. Then I say till when. They will say, some people will say 13 years like those days. Some people will say adolescent, that is 18 years. No, there is no limit. So dealing with children from when to what, that is what I ask. I tell, just now he mentioned about the preconceptual treatment and avoidance of folic acid to prevent neural tube defects. So pediatrics is a branch of medicine dealing with children from the time of preconception till the completion of adolescence, marking the end of linear growth. That is very important. Not even 1 centimeter, 1 millimeter he can grow unless they do some Chinese operation, multiple this thing osteotomy, and then to make the Chinese no. So it's very important. So that is the end of the linear growth. What are the 5 services given? Delivering preventive, promotive, curative. Just now you mentioned folic acid to be started right from the time. So preventive to prevent neural tube defects, and rehabilitative and palliative care. Okay, with the objective of helping the child. Very important. What is the objective of doing this? To make the child achieve the optimum potential inherent in that child. Every child has. Now you must have seen autism children are singing in super singers. One Karthik was singing in Saregama in Tamil Nadu, and then now he is gone to this thing, in Hindi he is singing. So that is the potential. Similarly, another small child used to, sing lot of songs in the, so they have potential. So we have to find out the potential and bring the best potential by constantly encouraging them and not criticizing them. So this is another exercise I give to all undergraduates and postgraduates. This recently NRHM Srinivasan conducted in April this thing, program, PG training program. The previous day there was a 1-day growth and developmental program. So PGs attended that. Some 30 PGs attended. I asked them to write height velocity curve. Okay. So this is how they start. Height velocity means, what is height velocity? 25 centimeters in the first year, then 12.5 centimeters, then it comes to 6.5, 6, then 6, but this is how they start. Okay, they start from below. So this is happening. You can test your own students sometimes. So they don't understand. I tell them height velocity means, I tell them you will go in the scooter at 40 miles per hour, then suddenly you will say board, you will see 20 miles per hour, so immediately you will decelerate, etc. But this is the status of affairs about the growth and development. Okay. So this is, of course, about the first person from 1720 to this thing. He meticulously measured his child from 18 years, 1759 to 1777, height velocity curve he has put. So the child is having 22 to 20, his son 22 centimeters, then it comes at 1 year to half of it, and then subsequently it is a static thing, then again the adolescent growth spurt. So it's very important. Okay, females have earlier growth spurt, but at a lesser this thing. So you can test it, whether what I am saying is true in your college or in your training period, go and test it. Okay, yes. Growth assessment, 3 experiences as external examiner. This is, of course, I don't want to mention the college. When asked to demonstrate how he took the height of the 12-year-old boy, given as a long case, after I saw him asking the sister to take the height. He was standing clueless before the old UNICEF donated weighing machine. There was a rod inside. That rod has to be pulled up if you want to take beyond a particular height. So he didn't know. He was just standing for home. Then I went and pulled up the rod and said, that there was a beam. Have you seen the UNICEF mission, no? All of you? Dr. Nair, that UNICEF, this thing, there is an inside rod which has to be brought up. Okay, he didn't know. That means he has never taken height, and so that is how what happened. In the same city, in another medical college, because 2 colleges were there, so I used to go as examiner. The candidate had not mentioned in his write-up the height and weight. I asked him to take them and plot it in appropriate growth chart. He went out to the other hall. I went out to 5 minutes, and the local examination hall coordinator is helping how to plot it. Okay. Yes. In another southern state, the only MD candidate from newly started private medical college is presenting a 4-year-old child with malnutrition. When asked about when the child doubles birth weight, when it becomes 3 times the birth weight, and after what is the acceptable weight gain every year, he did not know. Of course, his whole case presentation, mid-arm circumference, measurement and findings are wrong. Internal examiner from that new college was requesting to pass him, otherwise the management will not increase the PG seats. Then I told, you had come to JIPMER as examiner when you were in Vellore Medical College, and how strict you were. Now you are asking this boy to be passed. Okay, what do you think? The boy is supposed to pass or not? A person who doesn't know how to take measurement doesn't know. I am asking some of the frontliners. They will say, I am strict examiner. I am not strict examiner. I want basics to be known. I am not going to ask about genes of Wilson disease or so many other things. Okay. So this is the mother-child protection card. In every IVF training, we tell them how to plot the growth chart and what it means. Each and every color mentions, and so doctor, of course, you know about Raghupati's work and about low birth weights, intra-uterine growth retarded children given more food to make them grow fast. That is Barker's hypothesis. So they should have the same trajectory, which is very important. They should not be made to put on too much of weight. Then they have adult onset diseases like diabetes mellitus, carotid atherosclerosis, etc. Then exposure of UG PG students during clinical posting in pediatrics. One day visit to physiotherapy and occupational therapy units, I used to take them because there was excellent unit of developmental pediatrics and how to make the child have the physiotherapy and occupational therapy to improve their performance. So to sensitize them, how much effort their parents take to attend from far off villages. Those days concessions were not there, free bus services was not there. They used to come all the way to help the child to bring out their best. So I asked them to, at least they should be posted for 2 days in their 1 month posting. Okay, 5th semester or 8th semester, whatever it is. Okay. So then, of course, I asked them to see what all appliances are available, how the child is being helped, and how much improvement has occurred in some of the children. That's why they are coming repeatedly back to this thing in spite of all these difficulties. When I asked them to write their feedback comments without their names being written, I read one UG student's response mentioning that it was not necessary to show the unfortunate children to motivate us to do better. So I never told that these children are doing so well. Okay. Similarly, Sivaprasham is there. He had taken us to an autism training center. One child's, those notebooks and this thing were kept, and the handwriting was so good. But one postgraduate in the college where I was, private college I was working after retirement from JIPMER, his handwriting was never visible. I tell how the examiners will read your answer paper, man. So I told him, he had also come on that day. I showed, see, this autism child is writing so well. The handwriting is so good. So why don't you try to improve your handwriting? Still you have 1 more year to write your MD examination. So there are so many things which are happening that we have to see and then appreciate and help. Of course, we must not criticize in front of everybody. So even a postgraduate, you must only tell in private, not in front of other people. Otherwise, you never know. These days, they may go and commit suicide for some other reason and put the blame on the teacher. It is happening. Developmental delay, basic premise, okay, developmental screening. Early successful identification, Dr. M.K.C. Nair has already mentioned in detail about it. Necessary and essentiality of development of appropriate skills in the use and interpretation of some screening tests. So you must know how your screening test is helpful and how it has to be applied, and we must know how it is done. So that is why we have to have the training. Although there is perfect screening test available, combination of relying on clinical judgment based on history, physical examination, all these things are important to find out what is the etiology and the family background. I remember still, those days when we started our child guidance clinic, there was a child psychologist, Dr. Jayashankarappa. There will be some pictures, cards where there is a story. The child will be asked to tell what is the story about the father, mother, what is the internal environment. So the child will tell observation. So then, of course, what is happening in their house, whether the parents are very critical, etc., will be known. JIPMER Pediatric Child Development Clinic, evaluation, assessment, diagnosis and treatment. So these are the conditions they try to find out, and they have regular screening, hearing screening program, etc. Okay, and if the child is having deafness, central neural deafness, they tried cochlear implantation, etc. So of course, it was started during my time, and every postgraduate has posted in every every year they have to spend 1 month there attending the child guidance clinic. And of course, we have given, I have given PG this thing on cerebral palsy management and development, how they are improving these 1.5 years of their, and also another study on milestones in various groups. And also I had asked them to do nutritional this thing and development studies in Jipmer children, their growth pattern, etc. And also that is was presented in a pediatric conference which was attended by, again it was the Indo-British this thing arranged by Pratibha Singhi in Chandigarh. So it was conducted, and I presented these two papers of cerebral palsy, etc. And subsequently, of course, once Mahadevan became, he was interested in that, and he had done a lot of work on this thing. And Srinivasan was given, speech disorders, and he had done study, and now he has become a developmental pediatrician, and he is doing a wonderful job. So child psychiatry, child guidance clinic was started in this thing, WHS certificate course in nutrition, National Institute of Nutrition, Tarnaka, Hyderabad. Nutritional diet intake and this thing. I had gone for 3 months WHO program along with this thing. So many other, you must be knowing, people from Chennai also came. One Anandaraj came, who is a pediatrician, and so these are the things which are shown there in the during the developmental related activities, nutrition growth there. So we have to go to the villages and then find out the calorie intake, nutritional intake, and calculate, and also find out any developmental problems are there, etc. That was a great experience. Okay, and then we have the nutritional growth status of children in Jipmer campus and the immunization status just now I mentioned. Developmental assessment study was periodically given to students, and Danida training of field health workers. I was involved in Danida training in South Arcot district, and where we have to take the developmental aspect as well as the growth and pattern, etc. And ICDS Anganwadi worker training both in Pondicherry State, Karaikal, Yanam, and Pondicherry. I was involved in the initial training of them and subsequent retraining of these people, and community growth and nutrition survey we have undertaken in areas, especially Government of India wanted that to be undertaken in Karaikal. Then IMNCA program we have conducted, IS national trainer, where we stress upon the growth of the children up to first 1,000 days, and also the importance of breastfeeding and promoting appropriate growth, and also the microbiome which prevents various other adult onset diseases like diabetes, etc. And also we talk about its importance in microbiome, which causes neural networking and prevention of autism and hyperactive disorders in these children. This is all proved by studies. This is a Karaikal study. The project attempt to assess the existing tests of children and mothers in the slums of Pondicherry and Karaikal in terms of socio-economic, educational and indices. It was conducted between 93 and 94. So adolescent modular teaching I have undertaken. Okay, there are 8 books about the life skills of adolescents. We have trained teachers separately, the parents separately, and also the adolescent. We ask them, boys, we ask them individually, ask them their doubts and questions, etc. I am sure you must be aware of this program which was being conducted earlier. So these are the things which we try to find out. Okay. Early childhood development integrated concept, first 1,000 days, just now they have mentioned 2 to 5 years, then adolescence and pregnancy, very important. Just now Dr. Nair mentioned about the importance of nutrition, especially folic acid to prevent nutrition defects. Okay. Then of course promotion of adolescent well-being is very important, as I have mentioned that I have taken this modular teaching in schools there. So now I am coming to the important thing. Okay, adolescents, the following support confidence, resource to thrive in context of secure, healthy relationship, realizing their full potentials and rights. Very important. So that parents have to be helpful, the teachers have to be helpful. Nowadays they are very sensitive. If you tell something, immediately they go and commit suicide. So we have to be very careful about all what we are talking. So essential life skills, you know, all of you, self-awareness, respect, confidence, then clinical creative thinking we have to develop, problem solving and decision making, very important, planning and realistic goal setting, managing and controlling emotions and feelings, very, very important. Otherwise the suicide rate will be going up in India much more. And then social skills, healthy interpersonal relationship is very, very important, okay, especially the family. The child should be having the confidence to talk openly to the parents. That way we can avoid so many suicides and other problems. How many more minutes are there? Then effective communication, developing empathy is very important. Next. Resistance to pressure from peers, okay, negotiation skills, effective control, management of emotions and feelings. These and all should be nurtured, and appropriate team should be there to take care of these things, advocacy skills and consensus building. Okay, I will not, I'll skip this, okay. Two cases of adolescent suicides which I have seen in the last 2 years. Okay, adolescent 15-year boy came home late at night, woke up the father wanting to tell him something urgently, but father said, I was already asleep, I woke up, so why don't you go to sleep, tomorrow we will talk. Next day he was hanging. Okay, so it's very important that we must understand what is happening to the boy and try to this thing. Then 17-year-old adolescent medical student, daughter of this thing, another private medical college in the same city. Mother was a very strict dean in this thing in that hospital, and putting fine for everything. And the daughter, when they came home from this thing, child was hanging, the girl was hanging. So suicides are very common. So one must be very careful in dealing with adolescents. So this is the map of suicides in various states of this thing. It's available in the network, and Pondicherry is leading. Okay, I think it has stopped. Yeah, you can see highest percentage Lakshadweep 50, Uttarakhand 24%, Jharkhand, and states and UTs with higher percentage. Telangana 26%, UP Puducherry 23%. Okay, all India rate of suicide is very important. This is that's why adolescent care is very, very important, and how we deal with them is very, very important to understand. And of course, he is a wonderful person. I have seen him giving advice to adolescent problems, Dr. M.K.C. Nair. Okay, so this of course all of you know, where are various ways of communicating with the child and stimulating the child, most of your mothers. IAP current president Dr. Upendra has started Sankalp Sampurna Swastya. Remember my government Pondicherry school and college days, where we have gone to the college to measure the growth and developmental potential of the child and assess the potential. So yearly health checkup with height, weight and hemoglobin were done. Okay. Then NCC was very compulsory those days. NCC was very compulsory, and then we had to take, even if you are tall or thin, they will not, and then they will take the chest measurement, inspiration, expiration. All these things are not there nowadays. Is it there? This growth, this thing in the schools. So that is how we have done that. I had gone with my classmates to villages attached to JIPMER and had assessed growth parameters and nutrition and immunization status. So as both undergraduate and postgraduates have gone. So what my message is that, why not take it to the school? Why don't you postgraduates to conduct growth and developmental assessment in children? Because so many medical colleges have come. Those few medical colleges could do so many things. Why not with so many medical colleges? So with so it's very important. Yearly health checkup with height, weight, and hemoglobin, it can be done. See, when tailors can take appropriate measurements to stitch fitting clothes, ICDS Anganwadi workers and PS staff are trained to take weight, height. Why not train senior students and teachers to take these data and plot them? Okay, because I give this exercise to postgraduates, and invariably they don't do it properly. Okay, so we must take growth and development to the doorsteps of this thing, and we have enough hands to do that. One supervisor should be there. Okay. So take home messages, I had gone for intramural WHO fellowship to Jabalpur for remodel pediatric undergraduate curriculum. So there all the PGs are given responsibility. One fellow will be charting out the educational program of undergraduates for that month. One PG will go to schools to take height, weight and other developmental parameters. One PG will be maintenance of the vehicles which are going to these outdoor activities. Like that each one of them are given responsibilities. Okay. So he has done so much of school work about this thing, growth pattern, developmental pattern, etc. So besides the trained community health workers in rural areas, let there be exposure to UGs and PGs to children in schools and colleges. Let them go to this thing under supervision. Otherwise, they'll be wasting their time. So I had been there, of course, mentioned, and so this is what I am telling. So why not, when we are training auto rickshaw fellows to give cardiopulmonary resuscitation, and when we are training so many other people to do these things, why not ask them to take proper measurement and find out the children who are not thriving well or having deviant behavioral pattern, etc., developmental patterns. So with that, I think I can thank the organizers for calling me, and I hope I have done justice to my talks. I don't know. Thank you. I hope I didn't disappoint you. Thank you so much.
Thank you, sir. I request the delegates to rise up to give a...
I think we take this good opportunity to honor our orator, Dr. Srinivasan. Dr. Srinivasan.
And Behavioral Pediatrics chapter of IAP takes
We
immense
request Dr. M.K.
pleasure
Nair to
and
be
pride.
with him. Dr. M.K.C.
The IAP Growth Development and Behavioral Pediatrics chapter takes immense pleasure and pride in conferring the Dr. M.K. Nair Dilip Mukherjee Oration Award of 2023 on Professor Dr. S. Srinivasan, a teacher to thousands and a mentor to many. Make the planet a better place to live, either by a green plant, a smiling child, or a healthier life. With his sagacity and profundity, he has touched millions of lives, and he is due to deserve this award. Thank you, sir. Thank you, sir, for mentoring millions of young minds. We thank the office bearers of GDBP IAP and the organizing committee of GDBPCON 2023 for the oration session. We'll now go ahead with the scientific session.